So in the first part of the introduction video, we saw about what anatomy is. We also saw about its subdivisions, the various subdivisions in anatomy. That includes the gross anatomy, the embryology, the histology, as well as clinical anatomy, surface anatomy, and radiological anatomy. Now that we've seen about what anatomy is, we also discussed about the various positions and planes in the first part. So in this second part of the introduction class, we'll see various other terminologies that you should be familiar with. Okay, so the purpose that we're reading about these terminologies is that while reading every other topic in anatomy, they will be using these terminologies to describe every part. Even if it's a bone or an organ or any part in the body, they'll be using these anatomy in that. Okay, so these terminologies in that chapters. So in order to be just familiar with that, we'll move on to the various terminologies that are used in anatomy. Okay, so first we'll begin with what ventral versus dorsal is, also what anterior versus posterior is. Now we'll move on to some other terminologies. Okay, we already saw what ventral is. Ventral is referring to the anterior part. Okay, whatever is seen in this image is the ventral, and dorsal is the posterior part. Okay, back is the dorsal. Okay, so ventral and anterior means the front, whereas dorsal and posterior means the back region. Okay, this is the first initial terminology. This is important because while describing any bone or anything in the head and neck, they'll say ventral surface or the anterior surface. Okay, so that is more in the anterior aspect, or the dorsal means it is more in the posterior aspect. So these are the first initial terminologies that we're seeing: ventral versus dorsal, okay, and anterior versus posterior. The next terminology that we are seeing is medial and lateral. Now I already told you a word, median. Okay, median always means in the midline. Okay, medial means anything close to the midline. So let's assume this is the midline. Okay, so this is median. Okay, since it is situated exactly in the midline. Anything close to the midline is called as medial. Okay, so this part is called as medial. Anything away from the midline is called as lateral. Okay, so for the upper limb, I already told you this region is the upper limb, right? It has two borders, a medial and a lateral border. So this border here that leads to the little finger, this is the medial border, and this border here that leads to the thumb is the lateral border. So this is the meaning of the word medial and lateral. Okay, don't confuse medial with median. Median is always in the midline. Anything close to the midline is medial. Okay, so this is about median, medial and lateral. We'll move on to see the next pair of terminologies, that is proximal versus distal. Now for the upper limb, we saw, no, this is upper limb. Anything close to the root, this is the root region because it is attached to the rest of the body, right? So anything close to the root is called as the proximal part. Okay, so this forms the proximal part of the upper limb, whereas this away from the root forms the distal part of the upper limb. It can be like even for a single finger also. Let's assume this finger, okay, the little finger. The attached part is present here. Okay, so this part, attached part, is the proximal part of the little finger, and the away from the root is the distal part of the little finger. This one is the distal part. Again, for this finger, for the thumb, this is the proximal part because that is attached to the palm, and this is the distal part. Okay, so it can be, if you consider the upper limb as a whole, it can be two different things. If you consider each finger, then again it will be proximal and distal. So, for example, let's assume a person is wearing a ring in the ring finger. Is the ring worn in the proximal or distal part of upper limb? It is worn in the distal part of the upper limb. But when you consider only the finger alone, is the ring worn in the proximal or distal part of the finger? It is worn in the proximal part of the finger. So here in this image, let's assume the person is wearing a ring. Okay, so the person is wearing ring in the distal part of the upper limb. Okay, this is the distal part of the upper limb, but in the proximal part of the finger. Okay, so it can be different varying upon what we are describing. If it is the entire upper limb, the entire, or only the finger. Okay, so that's about the proximal and distal. So the terminologies that we saw is ventral or anterior, both means front, dorsal or posterior, both means back. Medial is anything close to the midline, lateral is away from the midline. Proximal is anything close to the root, and distal is away from the root. The next set of terminologies that we are seeing is ipsilateral and contralateral. Now, this is commonly used in case of any diseases. Let's assume a person is having head injury and this side of the brain there is some problem. Okay, because of that, this upper limb is not functioning. Okay, so the problem as well as effect of the problem is both on the same side. Then it is called as ipsilateral. Okay, if the problem as well as the effect due to the problem is on the same side, it is called as ipsilateral. Now, if let's assume the bleed is on the this side only. Okay, the bleed is here, but the opposite side upper limb is not functioning. Okay, then it is called as contralateral. The cause for something and the effect of that, if it is present on the same side, it is called as ipsilateral. If it is present on two different sides, for example, the cause is on the right side and the effect is on the left side, then it is called as contralateral. Okay, so that's about the next pair of terminologies, the ipsilateral versus the contralateral. The next two is cranial and caudal. Cranium is also another word for the bones in the head region. Okay, so cranial is anything close to the head is called as cranial. Anything away from the head is called as caudal. So if this person is having a tattoo, like one here and another red tattoo here, the above purple tattoo is present more cranial when compared to the red one that is present in a caudal aspect. Okay, so this is about the next pair of terminologies, the cranial versus caudal. Next one, flexor versus extensor. For this, you have to know what flexion means and what extension means. Now, what is a joint? A joint is a place in the human body. A joint is a place where two bones will join. So, for example, there will be bones here and there are two bones here. Okay. So, all these bones will meet at this junction and that is called a joint. Okay. So, that is a joint. When we move the upper limb, okay, so this is the angle of the joint. Okay, this is the elbow joint and this is the angle. Okay, when it is moved upwards, the angle will decrease. Okay, if the upper limb is here, the angle will decrease. That is called as flexion. When the angle increases, like how it is here, then it is called as extension. Remember, for the upper limb, all the muscles that causes flexion or decreases the angle will be present on the anterior aspect. Okay. In the front region, all the muscles will cause flexion or decrease the angle of the joint region. Okay, they are called as the flexor aspect. Whereas all the muscles in the posterior aspect will increase the angle. They are called as the extensor aspect. For the lower limb, it is the exact opposite. Okay, when you bend your knee, you will realize that the angle is decreased. Okay, so all the muscles in the back forms the flexor muscles and all the muscles in the front forms the extensor. It is opposite for upper and lower limb. Just remember at least one. Okay, the flexor aspect is anterior aspect of upper limb and posterior aspect of lower limb. So that is about the next pair of terminologies. Then we'll move on to movements. Okay, there are certain movements that you have to be familiar with because for every joint you will be reading the movements that happen at that joint. So first thing is adduction versus abduction. Remember, adduction always means that it is closer to the midline. Okay, adduction means closer to the midline and abduction means away from the midline. So when the upper limb, here you can see both the upper limbs are by the side of the body, that is, it is close to the midline. So this is called as adduction. Whereas in the next image, the upper limb has moved outward. It is going away from the midline. Okay, so this is called as abduction. This is the first pair of movement we are seeing. Adduction is closer to the midline. This hand is adducted, whereas this hand is abducted. Abduction is away from the midline. So that's about the first pair of movement. The next one, so once again both the hands are in adducted position. The next pair of movements is medial versus lateral rotation. For this, just focus on the elbow joint alone. Here you can see that the elbow joint is moved inwards. Okay, we saw now anything close to the midline is called as medial. Okay, it is rotated inwards. Okay, so it is called as medial rotation, and if it goes outwards like this, it is called as lateral rotation. So that's about the next pair of movement, that is medial and lateral rotation. The next pair of movement that we'll be seeing is flexion versus extension. We already saw what it is. Decrease in the angle of any joint is called as flexion, and increase in the angle is called as extension. So here you can see the upper limb, the elbow joint is, angle is this much. It is decreased. Okay, so this is called as flexion, and when it goes down like this, the angle is increased. So this is called as extension. Okay, so far we saw about adduction versus abduction. We also saw about medial and lateral rotation, and then we saw about flexion and extension. Okay, so this is just assuming in the one of the limbs, okay, upper limb or lower limb, those terminologies were used. For the trunk region, so this is the trunk region. Okay, in this region, we'll see what each of this terminology means: flexion, extension, lateral flexion, and lateral rotation. So assuming the trunk as a whole, here you can see the angle is decreased. Okay, this is the angle, it is decreased. So the trunk is flexed. Okay. Similarly, here the angle is increased. So the trunk is in extended position. Now during yoga poses and all, they'll bend backwards, no? That is called as hyperextension. Normal standing up is called as extension. So we saw for the trunk region what flexion, extension as well as hyperextension means. This is just a person normally standing, right? When they tilt to one side, it is called as lateral flexion. Now this is the midline, right? They're going away from the midline. So it is called as lateral flexion. So they can either laterally flex towards the right or laterally flex towards the left side. It can happen on either of the sides. So that is the next movement called as lateral flexion. For lateral rotation, that means twisting the upper half of the body like this. Now this is called as lateral rotation. This also can happen. We can laterally rotate to right side or towards the left side. Okay, so this is lateral rotation. So for the trunk region, we saw about flexion, extension, hyperextension, lateral flexion as well as lateral rotation. Then for the neck region, again we have the similar terminologies. Okay, here you can see the head is bent downwards. So the angle is decreased in the neck region here. Okay, so it is flexion of the neck, whereas this is extension of the neck. Here you can see this is lateral flexion of the neck, and this is lateral rotation, turning it towards, like saying a no, nodding the head. That is lateral rotation of the neck region. Then we will move on to just the jaw, because you will be reading about the temporomandibular joint. We might as well see what all movements happen there. The first is elevation. That means closing of the mouth. Depression is opening of the mouth. Protraction is when the lower jawbone that comes forwards. Then it is called as protraction. When it goes back to its place, it is called as retraction. So just focus on the jaw region. Here you can see that it is in its original position. Okay, here it comes forward. So this is protraction, whereas this is retraction. Okay, retraction is when it's moved backward. So the jaw region. Okay, retraction versus protraction. And this is elevation of the jaw, and opening is the depression. Okay, opening the mouth is called as depression in that joint. So this is some of the terminologies related to movements. Okay, we saw a list of movements. First we saw in general about adduction, abduction, medial rotation, lateral rotation, as well as flexion and extension. Then we saw about what all movements occur in the trunk region, what all movements occur in the neck as well as in the jaw region. Then we'll move on to some terminologies used in bone. So remember, the bone is not a very smooth structure. Okay, it has lot of projections, lot of depressions, something comes out of the bone, or there is a groove inside the bone. So it has lot of features on its surface. So in order to describe that, there are some anatomical terminologies used. So first, these three, they are all elevations from the bone. So all these three are elevations that are present in the bone. That is, something projects out of the bone. Here in the first one, a line, a linear projection, a line-like projection out of the bone. In the second one, it is just a sharp projection out of the bone. Here it is a rounded bulge projection out of the bone. Okay, the first one is linear, long enough. The second one is sharp, and the third one is rounded and bulged. Okay, so what is the terminology for these three? The first one is called as ridge or line or lip or crest. If the elevation is linear and long enough, it is called as one of these. The next one, it is called, when it is sharp projection out of the bone, it is called as spine or styloid process or horn or cornua or hamulus. Okay, so all of these, so in one bone it is named as different one, but it all means same, just a sharp projection out of the bone. The next one, a rounded bulged elevation, is called as tubercle or tuberosity or epicondyle or malleolus or trochanter. Okay, all of these are synonymous. It all means that there is a bulged or larger rounded elevation. So the various terminologies are tubercle, tuberosity, epicondyle, malleolus and trochanter. Okay, so this is the first set of terminologies related to the bone. Then the next three, these three are all depressions, okay, present on the surface. The first one is a linear depression. Okay, the next one is a smaller depression, whereas the third one is a larger one. Okay, if it is a line, if it's just a straight line, it is called as groove or sulcus. If it is small enough, okay, it is called as a pit or notch or fovea. If it is a larger one on the surface of the bone, then it is called as a fossa. Okay, so these are all some of the terminologies that is used to describe parts of the bone. Okay, then we'll move on to the next set of terminologies. These are also used in bone only. If there is a hole in the bone, okay, like this, in a very thin part of the bone, then it is called as foramen. Whereas if there is a hole and if that leads to an entire pathway, because the bone is very thick, you can see the bone is very thick. This is the thickness, whereas here it is very thin. Okay, then this is called as canal. Okay, this is called as foramen and that is called as canal. And inside the bone, okay, if there is air filled space, then it is called as sinus. Okay, and for the next one, I already told you what joint is, the place where two bones will come in communication, so that movement can happen there. Instead of being one continuous bone, here itself we have a lot of bones. Okay, so this is one joint. So each of those joint will have one fossa-like structure. Okay, and one here, a rounded articulating part. So joint region is also called as articular. Okay, so this smooth articulating surface can be called as the head. Okay, they also have various other terminologies. So this one here can be called as foramen or hiatus. This one here is called as canal or aqueduct. This one I already told it is sinus. Here it can be called this region. Okay, can be called as a head or a facet or condyle or capitulum or trochlea. These are some of the examples, okay, for such articulating parts. So in this topic, we saw first about what anatomy is, we saw about its subdivisions, and then we moved on to a whole range of terminologies, starting with the position, then we moved on to planes, and then we saw about some aspects like flexor, extensor, proximal, distal, and all of that. Then we saw about movements, and finally we saw about the features present on the surface of the bone.